Dr. Anthony Fauci, of course, the White House chief medical advisor of the National Institute of Allergy and Infectious Diseases. Doctor, good to have you. As you've seen here, 57 million vaccine doses have been delivered. Only 35 million have actually gotten them, though. What is the problem with that?
Well, there's a couple of things. Certainly, there is a discrepancy between the amount that's been delivered and the amount that's gotten into people's arms. It isn't necessarily as large a gap as the numbers show, because very often when you get a vaccine into a person's arms, it isn't reported as having been done for a period of a few days. So it's likely less of a gap. But there still is a gap, and that gets to something that you actually just announced a moment ago, is that President Biden has made it very clear as part of his strategic plan that came out a couple of weeks ago that we're going to do whatever we can to enhance and support the implementation of the administration. That goes to everything from what you just said about getting at first 1,100 military troops to be a part of the process of getting the vaccine into people's arms in several of the community vaccine centers that are out there, to ship directly to pharmacies, to use mobile units to get to not easily to access areas. So what you're seeing, Neil, is you're seeing the rollout of what was originally and is now in reality the president's strategic plan to enhance the vaccination program. That's exactly what we're seeing right now.
Doctor, we just came off one of the worst months for deaths, even though a continued improving trend on hospitalizations and the rest. There is a disconnect there. What do you make of that?
Yeah, that's the lag that you see. We've seen that so many times. When you get an escalation of cases, you don't see hospitalizations and then deaths to escalate for a lag of 2 weeks for hospitalizations and about 2 to 2.5 weeks for deaths. Right now, we're seeing a plateauing and a diminution of actual new cases per day. For example, several weeks ago, we were seeing something like 300,000 to 400,000 new cases per day. Now we're between 1 and 200,000. So they're starting to plateau and come down. The deaths will start coming down, but there will be a lag before they come down commensurate with the number of cases coming down. So this is not something that's surprising to see these couple of week lags between actual cases, hospitalizations, and deaths.
So I'm going to ask you a couple of dumb questions here. You're the doctor, you can help me out with this. And one that I hear is that even if you've gotten the vaccine, one or both doses, you should keep wearing a mask. Do you subscribe to that as well?
Yeah, the answer is yes, and there's a reason for that, because at this particular time, we're not certain whether or not vaccination is going to protect you against getting infected but having no symptoms. We know that the primary endpoint of the vaccine trials that led to the emergency use authorization that showed 94 to 95% efficacy was effective in preventing symptomatic disease. What we need to show is that it actually prevents you from getting infected, even though you don't have any symptoms. So it is conceivable that I could get vaccinated, I could get infected, but have no symptoms because the vaccine is preventing me from getting symptoms, but I still could have virus in my nasopharynx. In the next few months, we're going to be able to prove whether the vaccination actually makes that level of virus so low that you're not going to transmit it. But until we know that, there is still some risk, likely a small risk, but some risk that you may not know you're infected inadvertently because you have been vaccinated, but yet you might pass the infection to someone else. For that reason, we recommend wearing a mask even though you've been vaccinated.
You even raised the possibility of a recommendation wearing 2 masks. Is that right?
No, I wasn't recommending, Neil. What I was saying that there's a lot of discussion about that people have asked a reasonable question, common sense, that if one mask actually prevents you from getting infected or prevents you from infecting others, it's a physical barrier. So therefore, people have asked, well, if I wear 2 masks, would that be better? And the answer is, We don't have the data to make a formal recommendation of that, but it makes common sense that if it makes you feel more comfortable and more protected, there's nothing wrong with wearing 2 masks. So rather than have a formal recommendation, because we don't have the data yet, we say if you would like to wear one, go right ahead. I myself actually have in the past, and even now, occasionally wear 2 masks.
You know, the Homeland Security is kind of forcing the issue. The TSA, as you are aware, Doctor, is fining people who do not up to $1,500. What do you think of that?
Well, I think the president is correct. You know, when he first, actually even before he was inaugurated, he was saying that one of his policies would be that he would have 100 days of everybody wearing a mask. And that's at least 100 days, maybe more. Now, in order to really get the full effect, you've really got to get everyone to be wearing a mask. And you know, there's a lot of disparity in this country about people's feelings about whether they want to wear a mask. But there are some things that the federal government can have control over, that you could have a mandate to wear masks in certain places, such as transportation, trains, planes, or places that are controlled by the federal government. So I think we really got to get all on the same bandwagon here about wearing masks. And if one of the things that is going to help us get there is by a mandate that in certain locations which you can control, that you tell that people that they have to be wearing a mask. So I have no problem with that.
You know, the CDC director, Doctor, had talked about, you know, not all teachers have to be vaccinated to return to classes, but many teachers, unions in particular, are saying, well, not so fast. The president even parted company slightly there to say, you know, let's wait, examine this. Where are you on this? I mean, do teachers need to be vaccinated? Is it safe for them to be vaccinated before returning to the classroom? What do you think?
Well, certainly, if you want to look at 40,000 feet, that teachers, in my mind and in the mind of many, are essential personnel in society. So when you get to that area, which is 1B after 1A of the recommended priorities, that we should get teachers vaccinated as quickly as we possibly can. The actual guidance, as you were talking about, running up to this discussion, is that the CDC will be coming out with that soon. But the default should be, and has been for quite a while, that to the best of our ability, we should try to get the children back to school as quickly as we can and keep them in school.
But is it risky, Doctor, to let that, you know, if it means getting the kids back, getting everyone back for in-person classes, even though not all teachers have been vaccinated, is there any inherent risk to that? Or is there more inherent risk to that not happening?
Well, you know, you're asking a question, Neil. There is a risk to almost everything we're doing in this environment. So the question is relative risk. I mean, how much do you want to diminish the risk? You can have children going back to school, as we've had in the past, without necessarily having everyone vaccinated, all the teachers or all the students vaccinated. But clearly, what you're going to be seeing, as you said correctly, the CDC will be coming out with guidance to clarify that.
You know, you've had a chance now, a couple of weeks into the Biden administration, to work with 2 different presidents on the task force and dealing with this. Thoughts, comparing, contrasting?
You know, I don't think it's productive to look back and compare and criticize and get into that kind of a discussion. It really, right now, we've got to use all our energy to look forward. Right now, you know, I'm really very busy, fully involved with being the chief medical advisor to President Biden. We're out there doing the kinds of things that I feel are important, such as speaking to you and getting the message to the American public about the things that we need to do. We have a great challenge ahead of us, and that really is something that I think we all need to put our energies towards.
Now, President Biden lets the medical establishment, you know, experts like yourself, sort of run these briefings or task force strategies. Some have criticized his predecessor for trying to run that and then stopping them. Are you comfortable with the way the task force is running right now and responding to all of this, including this latest effort to have troops help get vaccines to folks?
Oh, yes, I'm extremely comfortable with how things are running. You know, as President Biden has said publicly, but he's also said it very emphatically to us in private, that science is going to determine our decisions, our policies, and our guidelines. We're going to base it on scientific data and evidence. And when we make a mistake, because we will stumble as when you have a certain challenging situation like that, but if and when we do, rather than complaining or blaming anybody, we're going to fix it. We're going to try and fix it. But I'm very comfortable with the fact that this is a process. And everything we do, we discuss in a purely scientific way. I haven't seen one bit of politics come into any of the discussions when we have our team, the medical team that gets together every single day. And as you well know, we're out there right now with press conferences 3 times a week. And when you look and see who's there, it's essentially the medical people.
So you said that without politics involved, was it involved prior, Doctor?
Again, I'm not going to go there. I'm not going to make comparisons. That only makes for sound bites. It doesn't help us.
Finally, a lot of people are looking at this and they're hearing about cruises to Canada, maybe the rest of this year, limit your foreign travel. It's a real hassle. Economically, this goes on. We're going to be wearing masks to the end of the year. What is your best bet? And I know it's a sort of a pie in the sky kind of a question, but when we are back to whatever normal was, what do you think?
Well, I think we will be approaching normal. I don't think, it's going to be a light switch you turn on. You're not normal and then click, you're back to normal. It's going to be a gradual evolution towards that. And I think as we get more and more people vaccinated, I had said in the past, and I'll repeat it now, it's an estimate of when you get to the point of so-called herd immunity, where there's enough people vaccinated so that you have an umbrella or a blanket of protection over the community. I imagine that would be somewhere between 70 and 85% of the population. When we get there, we can then start to think of approaching a rather considerable degree of normality. But between now and then, I think it will be a stepwise process. If, for example, when we get into March, April, and May, there'll be a substantial number of people vaccinated. So when we get into the summer, we likely will be doing things that we maybe were not able to do at a time when there was the 300,000 and 400,000 new infections a day. As the infections get at a very, very low level and the relative risk of having a problem becomes much, much less, then you'll find yourself getting closer and closer to normality. I hope we're well on their way there as we get into the fall of 2021.
All right, Dr. Anthony Fauci, a real pleasure. Thank you for updating us. We always appreciate it.
Good to be with you. Thank you for having me.